Dear parents, teachers, anyone responsible for young adults, I want to begin with an open, honest, simple question. How do you really know what your teen is feeling? Are they just managing their emotions or are they truly healing? Because right now, America is in a mental health crisis. 1 in 4 young adults report depression, anxiety, or emotional exhaustion. And yet, we still have been using the same treatments we gave teens decades ago. Antidepressants, mood stabilizers, SSRIs, happy pills. When will we realize that for many, these pills are meant to help us simply just function and not necessarily heal our inner emotions? What if I told you that there's emerging research on a substance, natural, that could potentially help people break through feelings of emotional numbness and even reconnect with their inner selves? FDA-backed, university-supported, and clinically supervised research suggests psilocybin, the compound found in magic mushrooms, can help people process their trauma in ways antidepressants often cannot. I know that sounds outlandish, and I understand the word psychedelic could even set some alarms off. Some may even associate it with the 1960s hippie era, drug culture, or even loss of control. But this isn't about teens tripping on magic mushrooms. This is about scientists, psychologists, psychiatrists, and therapists discovering that psilocybin-assisted therapy in a monitored, structured clinical environment can be very helpful, especially for a teen that has been noticing the same reoccurring symptoms with their typical SSRIs. Your teen might not even be aware of this. They may never speak on it. But many young people on SSRIs, antidepressants, as well as adults reported feelings like feeling numb, disconnected, emotionally blank, not sad really, but not necessarily themselves. Research calls these feelings emotional blunting. This is a kind of emotional shutdown antidepressants can trigger. Psilocybin does the complete opposite. Scientists and researchers from universities at Johns Hopkins, Yale, Harvard, and Washington University are finding psilocybin activates serotonin 2A receptors. These receptors are responsible for emotional processing, memory, meaning, and perception. Research shows psilocybin's ability to create neuroplasticity, the brain's ability to reorganize, break old patterns, and form new neural pathways. In a clinical trial published in JAMA Network Open, a single supervised session of psilocybin produced long-lasting emotional improvements without the emotional disconnection often associated with antidepressants. Patients described these sessions as an emotional reset, a reconnection to their identity, feeling like themselves again, and not just simply functioning. The way psilocybin unlocks inner, hidden, suppressed emotions in teens is what makes it so promising, because it's actually addressing what teens are quietly suffering through: numbness and burnout. I want to be extremely clear, psilocybin therapy isn't simply a teen being able to trip on mushrooms. A clinical psilocybin session looks like a medical supervised, controlled dosing. Therapists are in the room, a calm space, blankets, cushions, music, monitoring. And integration therapy days or weeks afterwards. This isn't something a teen does at home, nor anyone should do recreationally. This is not yet legal for teens, nor available outside clinical trials. It's a clinical, structured, guided, safe procedure. Parents, you're not wrong to have speculations and worry. Yes, unsupervised use can be extremely dangerous and cause panic and emotional overwhelm. But psilocybin is still a Schedule I drug federally, and yes, brains under 25 are still developing. These concerns are highly valid, but they point to regulation. Just how, like, anesthesia is so dangerous without supervision, but it's life-saving with it. According to the University Hospital's health system, psilocybin is safest and most effective when paired with psychological screening, therapist supervision, regulated dosing, and post-session support. This isn't about promoting drug use. It's about understanding that a treatment who may soon become federally approved for those who qualify. It's about knowing and understand this treatment works when talking about it with your teens who may potentially hear about it online. So, what should parents do with this information? Instead of shutting down the convo with your teens because it entails usage of drugs for therapy, ask your teen if they feel emotionally numb, if they understand the difference between therapy and drugs. Are their medications helping them feel or just simply function? Teens aren't searching for alternative treatments and therapies because they want drugs. They're searching because they feel emotionally disconnected, spiritually drained, or burnt out from their antidepressants. Staying open-minded and informed on psilocybin is very important, especially if you're noticing your teens feeling numbness within their SSRIs. Parents, this therapy is not yet available for teens, being there isn't enough research yet. But there's enough research that exemplifies that psilocybin helps people reconnect with themselves and inner trauma. We can't cling to outdated stigma while teens are silently suffering. The real danger isn't psilocybin research itself, but the refusal to modernize our understanding of treatment while teens continue to drown in emotional numbness. Healing shouldn't be about surviving, it should be about feeling, connection, identity. Psilocybin isn't about tripping, it's about restoring parts of us depression, burnout, and trauma tend to take away. Thank you for listening, and thank you for caring enough to understand science before judging the word psychedelic, especially when it's intertwined with therapy. Thank you.